Alright, let me kick things off with the basics of polymorphism. So, polymorphism happens when a single chemical compound can exist in more than one crystalline form. This means the molecule in the compound can be arranged in different ways in the crystal lattice. These different arrangements result in what we call polymorph. Even though they are chemically identical, polymorph can have different physical properties like melting points, solubility, and even bioavailability.
Right, and while polymorphs are about different internal arrangements, the crystal habits refer to the external shape of the crystal. So this is influenced by how the crystal grows under different conditions. For example, a compound might crystallize in a needle-like, or we call it a circular forms, or plate-like or tubular forms, depending on the solvent used or the temperature. So crystal habits are important because they affect how a drug behaves during manufacturing, like how well it flows in a tablet press or how it dissolves.
Exactly, and to identify these different polymorph and crystal habits, we use X-ray diffractometry, or we call it as SRD. It's one of the most powerful tools for analyzing the structure of crystalline solids. When X-rays hit a crystal, they are diffracted in specific patterns, depending on how the atoms are arranged. From this diffraction pattern, we can determine the spacing between layers of atom in the crystals, and it helps us to identify not only the structure but also to distinguish between different polymorphs. SRD is really considered the gold standard for phase identification in polymorphism studies.
That's so true. And this is significant in pharmaceuticals because polymorphs can have different solubility, which directly impacts drug bioavailability. For example, a polymorph with higher solubility dissolves faster in the body, making the drug more effective. But if a less soluble polymorph forms during manufacturing or storage, the drug might not work as well. So controlling polymorphism is crucial in ensuring consistent drug performance.
And even though crystal habits don't affect the chemical structure, they can impact the processing of drugs. So a needle-shaped crystal might clog machinery or lead to issues in the tablet formation. That's why pharmaceutical companies also monitor crystal habits during production to ensure smooth manufacturing and consistent dosage levels.
Exactly, in my observation and when we run an SRD test, the resulting 2D diffraction pattern gives us a clear fingerprint of the crystalline form. This helps us confirm whether the compound has crystallized in the correct polymorph or whether it's changed into another form. It's also great for detecting impurities, as those can show up as additional peaks in the pattern.
Right. And in addition to confirming the polymorph, XRD can help us ensure that we were not accidentally creating less stable forms, which might transform over time or under certain storage conditions.
Exactly, because a change of polymorph or crystal habits could lead to serious issues in terms of drug stability and efficacy. So that's why it is important for us to, as future pharmacists, to understand how these concepts play into the overall design and the production of pharmaceuticals.
Agree. Understanding polymorphisms, monitoring crystal habits, and applying SRD analysis, all of these steps are critical in ensuring that drugs are safe, effective, and consistent.
Alright, I think we have covered the main points. So polymorphism impact the drug properties, crystal habits affect the manufacturing process, and XRD is essential for identifying and controlling these forms. Solid work, team.
Yes, definitely. Great discussion.